Sometimes when I'm talking to people about RSI, I get the impression that they think their physical therapist is going to fix their problem for them. But there's a very important component with any physical therapy, and that's the home exercise program. So here to explain why your home exercise program is so important is Dr. Bridget Duncan. She's a doctor of physical therapy, a certified orthopedic specialist who has certifications in active release technique and the Graston technique. Welcome back to the show, Bridget.
Thanks, Deborah. Nice to be here.
It's nice to have you. So can you explain to our viewers why this home program is so important?
Yes, of course. So you brought up a good point. A lot of times people come to PT sort of wanting to be fixed. But a big part of physical therapy is actually the person or the patient taking their rehab into their own hands. The PT is there to provide education and guidance. So of course you're gonna within a session there's going to be some hands-on. We're going to facilitate healing, and that's really important through modalities and through techniques. But then the exercise component is crucial. Strengthening, and it might sound counterintuitive to exercise with pain, but strengthening is really, really important for RSI. The stronger you are, the better you're going to be able to handle physical tasks, and the less likely you are to injure yourself or to continue to injure yourself. The stronger you are, the less stress on soft tissues of the body, tendon, ligaments, muscles. The less likely you are to depend on, let's say, one specific muscle. Okay, so oftentimes RSI might develop in a certain area, let's say near the elbow or at your wrist, if you're overusing, maybe one or two muscles, whereas most tasks really require a group of muscles to work together in really good harmony. I mean, think of it like a group project in school, right? Everybody needs to pitch in. If one person is doing all the work, it's just the outcome's not going to be as good. So you really want all your muscles around each joint to be up to par and to be strong. So that's super important. Also, maintaining good posture, good core. That's important because the better posture you have, the better position you're going to be in, the less likely you're going to be to compensate. And just being strong increases your endurance. Having good overall endurance, you're not going to tire as quickly, and you're less likely, again, to compensate or to use sort of improper patterns that might injure yourself.
Speaking of endurance, they talk about cardiovascular endurance. Maybe you were going to say something else and we can bring that up later, but do you want to talk about the relationship?
Sure. So let's start with that. So different forms of exercise. You've got cardio, you've got strengthening, you've got range of motion. Cardio is really important because it's something that can be done when you are dealing with an issue with RSI, because you're not directly stressing that area, but you're working your body. You're improving your endurance. You're strengthening other areas of your body. So that goes back to the point that you're overall stronger, so you can tolerate a task longer. You're not going to fatigue as quickly. And then another component is that it increases circulation in your body. So it actually helps healing. Cardio exercise is excellent with any kind of injury because it moves the blood through your body. An injured area needs fresh circulation and fresh blood. So cardio is essential.
I found that to be the case when I was initially injured. I took a lot of ballet classes and I always felt better because, you're jumping, you're doing grand jetés, you're really moving, and it's cardiovascularly challenging. But a lot of people tell me that they have issues with cardio. They used to like to run, but the bouncing bothers their RSI. So sometimes I think just going for a brisk walk or up and down a flight of stairs where you're not jarring yourself or bouncing might be the thing, or getting on a stationary bike. What do you think?
Yes, all of the above. There's plenty of ways to get cardio exercise. If you have access to an exercise bike, that's excellent because it's low impact. You're not bouncing. I would say even an elliptical is an option if you have access. Oftentimes there's the option of using your arms or not. So if you are having a pain in the arm and you don't want to use the arms, you don't. And so that's a good option because you're not bouncing. Swimming can be an option. water aerobics, even, you know, anything that's not sort of creating that impact. And like you said, walking. I mean, if you don't have access to a gym or to any of that equipment, just get outside and walk. Or if you have a flight of stairs, go up and down a few times. Certainly.
Yeah, I think it's really invaluable. It also elevates your mood, and I think sometimes people with RSI tend toward depression because things get so overwhelming. And that cardiovascular system is, I think somebody called it, the best antidepressant.
Mm-hmm. Yeah, absolutely. It creates endorphins. Cardio is just, it's good for a lot of things, and it makes people feel happier. So in that way, it can really, really help with any injury has an emotional component to it. And I think in that way, cardio can be really helpful to deal with that, to help deal
So
with it.
I think I took you off track a little bit. You were going to talk about the areas that we need to target uh, with our exercises, and maybe you were even going to talk about how to do them.
Yeah. So strengthening is super important. And now you want to strengthen the actual area that's injured, because that's important. And it has to be done carefully and specifically. And you also want to strengthen areas which we call, and we'll go through them all, but the areas what we call are more proximal. Okay. Proximal means closer to the center of your body. So let's say, for example, you have an injury at your elbow, okay, or at your wrist, from whether it's typing or using the cell phone, or any repetitive motion you're doing throughout the day, which most of us do. It's really important to be strong closer to the body, meaning your shoulder, your upper back, your core, even your neck muscles. You know, that area, that's your base. That's your base that your whole arm is anchored on. Okay. That needs to be strong. If that's not strong, the little muscles down the arm have to work harder to do the task, and they're taxed too much, and that leads to the injury. Okay, so it's important in order to prevent injury, but also to help alleviate stress in the more distal, meaning farther from the center of your body, those areas. So those areas are important to strengthen. Now, when we talk, and that can be done through, you can be, it's good to seek some advice as to what exact areas need to be strengthened. But, you can be shown an exercise routine that you can do at home. You don't even need a lot of equipment. It can be bands or simple weights that you might have at home, or even body weight. Now, when it comes to the actual area that's injured, you want to make sure you're not doing the repetitive motions that cause the injury. So that's
Yes, I can't agree with you more. People think they should be doing wrist curls, and it's
right.
like compounding the problem.
Exactly.
You're adding weight onto weak and injured tissues.
Mm-hmm.
So glad you said that.
So as I mentioned earlier, the muscles surrounding a joint that are involved in a task, they need to be balanced. They all need to be strong. So you need to target, and this is where a therapist can help you, is target the areas that are weak, and strengthen all of them. And when it comes to the actual muscle or tendon, or the area that's injured, that needs to be strengthened too, but you can't go through repetitive motions like we just said. I really like isometrics, which are gentle. Isometric means that you're contracting the muscle, but you're not moving it. So for example, if I want to strengthen the muscles on the outer part of my forearm, these are wrist extensors, I can just block my hand and push against it like that, and I'm causing these muscles to contract. Okay, it's a gentle strengthening exercise, but I'm not going through any repetitive motion. Okay, so that's a good place to start. And then eccentric is another type of exercise, and that is strengthening a muscle while it's elongating. Okay, so what that means is, and I'll show you an example with my bicep because that's just the easiest one to show. If I'm holding, let's say, a little weight in my hand and I'm lowering it, my bicep is elongating while I'm lowering it. Okay, now I'm going to use I'm going to use my other hand to bring it back up. So I'm not doing this. Okay, it's the lowering process. And that can be done with any joint of the body. I'm just using my bicep as an example because it's easy to show. That eccentric motion, also the isometrics as well, are therapeutic for tendons because it creates a gentle stress that helps to remodel the collagen fibers of the tendon. Okay. But it needs to be done with guidance because you don't want to do anything that's going to overstress an area that's injured. So you need to make sure the timing of introducing these exercises is correct.
I think we all need expert guidance from a skilled physical therapist when we have RSI or anything else. But it's so interesting because I used to work in a gym, and a lot of the trainers would really like to do eccentric contractions for strength. It was sort of one of those insider secrets that people would do. And I think even with when I'm cueing people doing rows, I tell them to keep their shoulder blades together as they're lengthening their arms in the eccentric portion of that. Because I think that really helps you keep your shoulder blades paced, and you're getting strength coming and going. It's not just the pulling, you're still strengthening as you're releasing the arms forward again by squeezing your shoulders together.
Yeah, absolutely. And I actually I like that. And to your point, you're eccentrically strengthening when you're bringing your arms back out. But by keeping your shoulder blades tight in the back, you're actually isometrically strengthening those during the period when they're not moving because you're holding them. And that's important for posture. I mean, if we think about it, posture, you're isometrically using your muscles because you're holding yourself. You're not moving, but you're isometrically using the muscles that are involved in posture. So that's great. That's important.
Yes, and so much people sometimes they come to me for the exercise program, and a lot of people, they're overstretched in their back because their posture, they're very internally rotated in their shoulders, and they don't have the strength to keep their shoulders. So I give a lot of back extensions and back strengthening exercises. And one physical therapist told me once, I'll never forget this. She said, an overstretched muscle can cause as much, if not more, pain as a tight muscle. And I thought, bingo.
That's true. An overstretched or over lengthened muscle not only can cause pain, it also can create a weak muscle. And they kind of go hand in hand. And you're right, this day and age, we spend a lot of time on computers, we spend a lot of time on devices, and we're like this a lot. And so these muscles back here get over lengthened, they're usually weak, and then they become painful. So to your point, exercises to strengthen those muscles to get out of this position are super important to get out of that kind of repetitive pattern of stressing the muscles like this.
This is sort of the perfect segue to the next tricky issue here, which is stretching. I like to sort of suggest that people do a range of motion, but not stretching, because so much of what I see touted as good for RSI is actually violent and overdone. Can you talk to us a little bit about that, Bridget?
Yes, I agree. It's really important not to, to overstretch or to force any stretching. You also have to identify if elongating or working on range of motion is important for certain muscle groups. So just for a second, going back to this, the idea of kind of sitting forward like this, which a lot of us do, the back muscles are now elongated. They don't need to be stretched, okay? Because they're already stretched out. So first you have to identify what needs that work on mobility. Okay, so in that case, you really need to work on opening the front of the shoulders. But in general, an area that is dealing with a repetitive stress injury, range of motion is important. You need to identify if there's a lack in range of motion. So I'm just going to, for example, use my wrist. Okay, I should be able to bend my wrist all the way like that, right? If these muscles are compromised here, I might not be able to. Sometimes they reactively shorten, and then you don't have that full range of motion. Maybe I can only get to here, okay? The tendency might be to be like, oh, I gotta stretch them down like this. But that can kind of stress things out, and without the proper guidance, you could hurt yourself. So at least in the beginning, a really good way to do it is just actively. So that means I'm just gonna do it on my own. I'm gonna use my own muscles and this arm to create the motion. I'm not gonna use my other hand to force it. Okay, so that's a really good place to start. Another reason that's effective is something called reciprocal inhibition, which is actually it's like a neurological phenomenon in the body, where if I'm using the muscles on this side of my arm, the reciprocal muscles on the other side have to relax. So if I'm doing this and I'm engaging these muscles, reflexively, these are letting go. So that's actually a technique that helps you to relax these muscles and elongate them without forcing them.
So interesting. So interesting. I mean, the body has all of these fascinating checks and balances. And my favorite is actually the GTO, the Golgi tendon, uh, Golgi tendon organ. Yeah.
Golgi tendon organs. Yeah.
Yeah.
The receptors.
I understood it to be little breaks, like if you're, for instance, doing a forward bend and your back starts to, and if you go further, you're going to blow out one of your discs or something.
There are receptors in the muscles and the tendons that kind of give the body, the central nervous system, the brain. You don't even have to think about it, but it happens. It gives them a message and says, "Oh, like you might be going too far." So
yeah, I imagine all these little people with little, like the flagmen at the airport waving the air traffic, saying, "No, no, 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 that's far enough. Stop, stop."
That's a good way to think about it. But yeah, the body's amazing. We have all these little systems inside that work without us having to think about it. So it's pretty cool.
Yes, I think sometimes it's better if we don't use our will to override. There's such wisdom in moderation. And as a society, I don't think we're particularly moderate. People want to go further and go to the max and, do the reps to fatigue. And I'm thinking, no.
Yeah. We're also impatient. Like we want it done now. We want to fix it now. So like, let me just work really hard and do all the reps and maybe I'll get better faster. But sometimes you need to have a little patience and go through the progression as, appropriately so that,
maybe this is something we should talk about, because sometimes people do want it now and they overdo, and then they set themselves back in recovery because instead of doing a moderate program that's stepped up gradually, safely, intelligently, they think, well, she said do 10 reps, I'll do 30.
Right. More isn't always better. Stick to the routine, seek advice, and a routine that can be done at home, and stick to that routine. And then if you feel like you can do more, ask, before going ahead and doing 10 more reps, because though everything's feeling great, just make sure it's appropriate, because more isn't always better.
I think we talked about this before, but it bears repeating. What about if you feel like an exercise is aggravating you, or maybe 10 would be okay, but 20 is just not? So what do you recommend for people when they feel that sort of sensation?
Yeah, it's important to listen to your body and to notice what you're feeling. Oftentimes I say, and it kind of depends on the injury, but usually I'll say, a little discomfort, whether it's like a 2 out of 10 or something like that, that's generally okay as long as it doesn't persist afterward, or as long as it doesn't get worse. But anything getting into like 4 and above or anything like that, then it's really too much, and you're probably going to aggravate things. So I wouldn't push beyond that. I would stop what you're doing. And then, maybe your therapist will give you something different, or maybe tomorrow it'll feel okay. Maybe it's just today it's not right. So definitely listen to what you're feeling.
I have a question for you in terms of pacing and what to do. I personally do an exercise program every single day because it makes me feel warmed up. I feel like the synovial fluids are flowing, and it just makes me feel good to have done something every day. What do you recommend?
Yeah, some form of exercise every single day is awesome. You don't necessarily want to do the same exact exercise every single day, because that can be too much, but switch it up. So maybe there's a certain routine you do 3 times a week, and then you have another routine that you alternate with that. But movement and exercise every day is awesome, unless you're doing some really heavy exercise. Then you need a day off. If you're at the point where you're, squatting lots of pounds in the gym, or you're running many, many miles, that kind of stuff, you definitely need a day off. But if you have a gentle strengthening routine or cardio routine, you can certainly do it every day, as long as you're switching up the body parts and kind of changing what you're doing.
Yeah, so when I used to work in the gym, and I still do this practice myself, if I'm doing any sort of lifting or resistance, I do that every other day. and I don't do the same muscle group. You know, like people would do their upper body one day and then rest and then do the lower body the next day. So there's always something different going on. But what I typically do is a mat routine that strengthens my core and my spine. So it's the proximal that you were talking about earlier. I do that every single day.
Yeah, I agree with that. You can certainly do those mat exercises for core. You can certainly do every day. And I think it's beneficial to do every day. It just gets things firing, it gets things going, and it keeps things strengthened. And that's a really important area of the body to maintain strength. Sometimes I'll do upper body and core one day, and then the next day lower body and core. But I always kind of throw in some of those core exercises because you can certainly do them every day.
Yeah, I think that's the one part that everybody sort of needs, and keeps you strong. Do you have anything else that you'd like to tell us about exercise or?
The only other thing I think I would throw in is that it's always important to warm up. You don't want to just grab a weight and start going. I would do even some gentle cardio before doing weights is nice, just to get the blood moving, or just some active movement. Sometimes a few yoga poses are good. Get on the floor and do some cat cow. I mean, it's important to do some gentle movements first before you do kind of the more strengthening exercises that you have prescribed. Gets the blood going, it gets the muscles primed, gets you ready to go, gets the oxygen flowing, which is what you need.
Yes, I think it's just everybody, you wonder why you feel so wonderful after an exercise program. It's because you're oxygenated and your blood is flowing, and your skin is glowing and all of these wonderful things. I mean, if they could create a pill that did what exercise does, somebody would make a fortune. Or if you or I could exercise for other people, we'd be gazillionaires. I think a lot of people, I just can't. But it's the best.
It is the best. And I think what's nice is that I think the hardest part is getting into it, but then taking that first step. But then once you've done it consistently for a few days, I think it starts to become, people start to realize how good it makes them feel. And then oftentimes then it sticks, because it's like you want that feeling. And that's a good feeling to start to have and to get into, because then you just want to keep going.
Yeah, it's a good habit.
Mm-hmm.
It's a good habit to have, exercising.
Definitely.
All right. Well, on that note, I hope everyone goes out and does their exercises faithfully every day and heeds if you're lucky enough to get Bridget as your physical therapist, you will get some really interesting exercise programs. But look around, find someone in your neighborhood who you connect with and who helps you get over the bumps. And we will see you next time.
Thanks, Deborah.
Thank you.